welcome to our 225 webinar of the Andean Health Organization Hipólito Unanue Agreement. We've been working for 3 years already when we started with this cycle of webinars in May 2020. Today, Thursday, May 30, 2024, we are pleased to present the webinar entitled Road Safety, Policies and Intervention Strategies in the Face of a Global Emergency. I would like to start with a very important concept. Positive peace, which is defined as the attitudes, institutions, and structures that create and maintain peaceful societies. It is essential for the well-being and health of people, as it allows their rights to be respected, their needs to be met, and their capabilities to be enhanced. Therefore, from the Andean Health Organization, Hipólito Unanue Agreement, we promote health as a bridge to peace. Children and adolescents, boys and girls, are not only the future, they are our present. And their development and well-being depends on what we do now to actively contribute to the social and environmental justice that the Orasconu pursues. Reflections on these and other priorities relevant to health and well-being can be found in the monthly NotiSalud Andinas newsletter, available on the website of the Andean Health Organization and in the Andean Integration Knowledge Showcase. We invite you to leave us your name, organization, and country from which you are joining us through the comment box of the Facebook chat or YouTube Live. In the same space, you can leave your questions or send them via email to webinarsorasconu@gmail.com. To access the certificate of attendance to this webinar, as usual, you must fill out a short survey and leave your data in the fixed link found in the Facebook or YouTube live chats. Please remember to check that your email is spelled correctly. This webinar has the following dynamics. We will start with institutional greeting, followed by keynote speeches, and then we'll start the dialogue based on the questions left by our participants in the different platforms. To begin this important day, I would like to give the floor to Dr. Marisela Malki, Executive Secretary, Deputy Secretary of Orasconu, who will give the welcome and institutional greeting. Thank you, Ruby. Good morning, good afternoon, depending on where you are. It's May 30th today, and thank you for joining us on road safety policies and intervention strategies in the face of a global emergency, which aims to highlight the actions being developed within the framework plan of the Global Plan for the Decade of Action for Road Safety 2021-2030. Recognizing the importance of the problem and the need for action, governments around the world unanimously proclaimed through the United Nations General Assembly Resolution 34299 a second decade of action for road safety 2021-2030 with the explicit goal of reducing road traffic deaths and injuries by at least 50% during that same period. This plan sets out the actions that need to be taken to achieve this goal. It is aimed at key policymakers and should serve as a model for the development of national and local plans and targets. As we embark on the second decade of the action for road safety, governments and global stakeholders must then choose between business as usual, in the hope that this will be enough to significantly reduce the number of deaths, or act boldly and decisively using the tools and knowledge gained from the preceding decade of action for road safety to change the course. Road traffic injuries are one of the leading causes of death and disability around the world. According to the World Health Organization, approximately 1.35 million people die each year as a result of road crashes. And between 20 and 50 million people suffer non-fatal injuries, with a proportion of these suffering some form of permanent disability. They are the leading cause of death among children and young people aged 5 to 29. One out of four of all road traffic fatalities affect pedestrians and cyclists. As the international organizations point out, road crashes and their consequences are avoidable if they are properly addressed, including determinants such as the human factor, which is mainly associated with the unsafe behavior of road users. To modify these behaviors, the organizations stress the importance of establishing precise rules on expected safe behaviors. Also, control and enforcement systems, effective and legitimate, and actions aimed at raising awareness and educating road users. The inclusion of specific road safety targets in the 2030 Agenda reflects the universal recognition that road traffic deaths and injuries are now amongst the most serious threats to the development of the countries. This means that road safety cannot be threatened or sacrificed in exchange for meeting other social needs. In this context, road safety should not be addressed as a standalone issue, but rather as an integrated component of many different policy agendas, including those addressing child health, climate action, gender, and equity. The constant evolution of transportation around the world presents us with multiple challenges: greenhouse gas emissions and climate change, air pollution, dependency on fossil fuels, an epidemic of chronic diseases, and the risks of death and injury from road traffic collisions. Rapidly evolving technology, increasing population density and population growth in urban areas, along with the emergence and growing presence of micro-mobility and the use of mobility services, are indicative of today's challenges. In fact, the efficiency, accessibility, and safety of transport systems contributes directly and indirectly to the realization of many SDGs. These considerations justify the need to orient road safety policies based on data on the types of accidents and their characteristics, as well as knowledge of the circumstances where they occur, the factors related to exposure to traffic, people, the severity of the event, and its consequences. We are therefore grateful for the presence of outstanding professional experts on the subject: Dr. Melissa Campos Zamora, consultant of the Clinical Services and Systems Unit, the Department of Integrated Health Services from the World Health Organization in Geneva; Dr. Gaby Vivian Lencina Borges, doctor in Law and Social Sciences, Director of DEMOS, Rights in Mobility and Road Safety, founding member of REDUX, Alianza Iberoamericana de Movilidad Segura, Uruguay, and to all of you for your interest and support week after week. Welcome, and thank you very much to all of you. Thank you. Thank you very much, Dr. Malki. After this, I would like to introduce myself. I'm Ruby Diaz. I'm a public health and global health professional at the Andean Health Organization. Today, I'm pleased to be in charge of moderating this webinar. This was coordinated with Dr. Mandy Moscosa, who, because of health reasons, could not be here to moderate our webinar. Unfortunately, after this preamble, we extend a warm welcome to Dr. Melissa Campos Zamora. Dr. Melissa Campos is a consultant for the Clinical Services and Systems Unit of the World Health Organization in Geneva. In this role, she coordinates the unit's activities in the Americas region, promoting the strengthening of integrated emergency, critical care, and operational health services. In addition, she supports a wide range of educational projects to strengthen human resource development within the spectrum of integrated health services. She has experience in educating healthcare professionals in a wide range of settings and care levels. She was the Deputy Director of Curricular Innovations for the Graduate Medical Education Unit at Harvard Medical School, where she supported the transition to the online environment during the COVID-19 pandemic. She received a Master of Science in Medical Education from Harvard University. She completed a specialty in gynecology and obstetrics at the National Institute of Perinatology in Mexico City, and previously earned her medical degree as a surgeon from the National Autonomous University of Mexico. In addition, she is an emergency medical technician and volunteered in this role for 5 years. As a researcher, she has 11 articles published in international index journals. Welcome, dear Dr. Melissa Campos. Now the floor is yours. Thank you very much, and good morning, everyone. Thank you for the invitation to discuss and share with you a little bit about this very important topic, which is at our heart, and this is why we've been working on this for the past years. I will now share my screen, if you allow me. And we will speak about something which is very important when considering road safety, which is the post-injury area. As you know, there's a plan, a world plan for action, as I mentioned before, and we will mention some pillars to strengthen the results of people who unfortunately are victims of this type of accidents and events. Well, and at the office in the clinical systems unit, we've been working in collaboration with the Road Safety Office of the WHO, and we've been strengthening this in the Americas and promoting the post-injury service. And something that I will share with you now is about the tools and the programs that are out there. So this is an important call for action to promote safer systems based on 5 pillars: multimodal transportation and land use planning, safe infrastructure, safe vehicles, safe use of trafficking, and some other important things. We know how important it is to work on prevention, and especially in the four mainstays, but unfortunately, because of all the preventive measures that we have, there might always be emergencies and problems, and making sure that there's an adequate response is fundamental to improve the situation of those affected. From the perspective of road safety in the World Plan, there are specific measures which are recommended to strengthen the response. Now, there's supposed to be a secure mechanism for the response and those who work on this. Then the fourth one, it is having support for the families and try to reduce this and prevent this from happening again, and judicial and social support for the families. This is from the perspective of road security, but unfortunately, the clinical unit from the World Health Organization, from there, we believe very firmly that the emergencies, as you well know, happen everywhere. So everywhere at any given time, specifically, we're talking about these, but these are not the only emergencies that are there. And it doesn't matter if there's a system incapable of getting resources. What do we need for this is that the person who's injured receives adequate services at the right time and in the right way. If we can do this, this will be and entail a big difference. There's a lot of evidence saying that pay attention to these emergencies can save lives, and there's more than half of the deaths that happen in low to medium income countries are because of conditions that if they were receiving adequate emergency situation, they might be prevented. This is actually a very high number, as you can imagine, and proves that there are many baseline inequalities in low and medium income countries. We saw how in countries investing in this type of services, the mortality figures are reduced and the results get better. Given all of this, there's a big boom now and a big push from our institutions to strengthen emergency health services, but not only in emergencies, but critical care and operational care, among others. Last year, in this week, we have the 76th World Health Assembly in Geneva, and 1 year ago, the 76.2 resolution was approved about strengthening integrated emergency critical and operative care for universal health coverage. This is not the first resolution that the countries signatory to the assembly have approved. This is not the first time. However, this is the most recent one. And in this year, this week, we are evaluating, and this has been accepted, even the global strategy and action plan for integrated emergency, critical, and operative care. We call it ECHO. This is how we call it. And it is important to mention this because we firmly believe that there's a continuum. This is not that it only works at the pre-hospital or hospital level. This does not happen oversight. The spectrum of ECHO, as we call it, accounts for a continuum of services going from the community up to the health centers, where the person, after having an emergency, can be at home, and only by covering this whole continuum, we will be able to assist someone who has suffered from an injury. Now, thinking about this, also, we've found that ECHO should be cost effective. So that you have an idea, investing on emergencies care might cost in American dollars. Getting an ambulance equipped and with staff in a rural area has an approximate cost of $284. Then having an equipped ambulance and with staff for 1 year at an urban area has a cost of $94. This is estimated, and training first responders and paramedics has a cost of $7 approximately to save a life. This is per year, compared to investment and treating using antiretroviral with antiretrovirals, people with HIV, 922. Both things are essential, but the cost effectiveness of our strategies is clear. And unfortunately, in many of our countries, we have not made sufficient investment, if you will. And there are recent studies saying that not only pre-hospital care, but strengthening emergency coverage at the hospitals might have a return on investment of 418%. Why do we share these figures? Those who are making decisions, those who are capable of deciding what are the strategies, are those people who are thinking about it. So it is important to know that apart from this having a lot of potential, it is highly cost effective. So what is an emergency care system? I will allow myself to share a video to discuss the whole spectrum. Every day, millions of people need emergency care. People seek medical attention for infections and injuries, heart attacks, cerebrovascular events, asthma, and acute complications of pregnancy. An organized system, an integrated system, provides and moves people towards care. The emergency care, if it's timely, it saves lives. When our emergency happens, the pedestrians are essential to provide first aid until a professional arrives. The pedestrians need, first, to be able to ask for help, ideally through a universal access number. Two, know what are the basic first aid concepts to be caring after casualties and being protected by a Good Samaritan law. The universal numbers allow the pedestrians to activate the system so that pre-hospital suppliers are sent. Once on the scene, these suppliers might evaluate and stabilize the patient for their movement. Through specific protocols, they identify the destination hospital that best fits their needs. During the transfer, the condition of the patient is evaluated all the time. The ambulances always need at least two people, one to assess and care for the patient throughout the transit, another to drive. If it's necessary, the staff has to communicate with the hospital before their arrival. At the hospital, throughout the delivery, the supplier of the ambulance provides information to the hospital provider. While the patients arrive, they are classified in different areas through the triage to guarantee that their condition, putting in life in danger, is recognized and that all the people will receive the care they need whenever they need it. Triage is performed through the classification of patients in categories. Some people need to be cared for immediately, while others can wait. Clear protocols and specific equipment is used to evaluate patients. People can be admitted in other units to receive additional hospital care, being referred to other hospitals or being discharged. An effective system needs law and regulations, protocols to guide the hospital staff, certifications for standard compliance, and accreditation processes. There are different standard indicators which might be used to evaluate the performance of an emergency care system. These might include, for instance, time intervals between key actions or clinical results. This brief summary summarizes the essential functions advised by the WHO. These components might be implemented in all of the countries in different ways depending on the resources available. To obtain more information about the tools of WHO to strengthen emergency care systems in the countries, please visit the website of the WHO. Remember that timely care saves lives.
La información presentada en el
The information presented in the previous video is reflected in the reference framework of emergency systems of WHO. This tool is available on the website in English, Spanish, and other languages as well. And it is actually an infographics, but it is a full reference framework that describes the essential functions that are necessary in looking after an emergency. And it's designed for ministries, policy makers, and more, and facilitates the identification of gaps where improvements might be implemented. What happens when someone has an accident? Who arrives? Who's supposed to make the call? What's the number to be called? It's supposed to be free of charge. If this person is trained to provide some initial care, who receives the call, where this person is, if there are delays in determining which emergency unit should go to the site of injury, the credentials, certifications, and what's the care provided through the transit. It is important to condition where it's being moved, what's the guidelines that that the ambulance has two people following all the protocols to be able to move a person who needs or relocate someone or transfer that person who's had an accident. And what are the protocols that will be used to perform an effective delivery of the patient to the site? Then at the site, what protocols are there to receive a person who has had an accident, if there's someone in charge of triage, if there's a registry, if this happens before or after triage, what's the processes out there in the emergency unit to prioritize those who are more seriously ill, and same as how the process will go about for someone to go to the critical care unit or the surgical unit if this is necessary. This description, well, I like it very much. When we think about an emergency, we only think about an ambulance, making the call, but we don't really have an integrated perspective of what needs to be there to have it working effectively. And this is what we are promoting, to have the whole picture of what happens and what's each piece doing in this huge puzzle to improve the outcome of someone who has an injury or an acute disease based on the reference framework. The WHO has a lot of tools for each one of these areas. I will give an introduction of these tools, but before I wanted to mention a publication that the Pan American Health Organization, in collaboration with the WHO, based on the work it's been done, published last year this document to strengthen trauma coverage in the Americas. And the main recommendations to strengthen care are here on the slide. They've been broken down in the document. The first thing that needs to be there is legal framework, a policy that will refer to how important it is to strengthen emergency care, that it will, of course, have financing secured.
¿Quién le dé seguimiento? Una oficina, una...
There needs to be someone, a unit responsible for strengthening this at the local level and tracking this. We have, and we also need a situational analysis. How our emergency care system is at the different levels of care, but what's missing, what gaps are there, and where are investments to be geared towards to strengthen this. There needs to be effective access to pre-hospital care. There needs to be ambulances and staff, and they should be at a relatively short distance in order to arrive promptly to anywhere where an emergency might be. Effective access to care and effective care, and they should be there 24 hours of a day. Unfortunately, many places there's pre-hospital and specialized care, which is always limited to different days of the week, different schedules, and they should have not been assigned somewhere else before, and so on and so forth. So in number 7, we are training and certifying human resources. These workers who devote to working on pre-hospital emergencies, they should have access to protocols, and the information about care that they provide needs to be collected strategically, and there should be technology to know and be able to follow what's going on. So I would like to invite you to look for this document. Take a detailed look at it. This is something that's been prepared in Spanish. There are other documents that I can share with you later on, but this is a very good summary, I guess. And now we will speak about the tools that are out there to work in each one of these areas. This is a very short summary, but it is important to share what we have. The first tool is EXA. It's critical care and emergency care evaluation. This is something that we do to evaluate the emergency system in several steps in collaboration with the local stakeholders. And I'm sorry, but she's going way too fast. There's a survey, an interview, and then there's a meeting organized to have a consensus of what the gaps are in this particular system and what are the actions that could be used and what are priority actions. This exercise can be carried out at the national level. In the region, we did this in Paraguay, in Costa Rica, in Jamaica, Belize, and there are some others underway. But this is an exercise that is being pushed by the local governments. And we can do this differently if it's necessary. So based on all of this, the WHO recommends for each one of these areas, there are different tools to be used. This is a brief summary depending on what are the priority areas. If the priority area is development of pre-hospital standards, there's a course that has been implemented by the World Health Organization. There might be other areas to work. We have multiple tools. There are some which are disseminated like emergency teams. There's also a course to know what to do when there are multiple casualties and different guidelines also. If the problem is quality standard and data collection, there are standardized forms, and there's a clinical registry, which is an open platform of WHO, which allows the countries in the region or the hospitals to collect data accordingly to be able to see how the data is, what's the condition of this data, and there are strategic training sessions. I will mention them. There are clinical protocols, there's triage, checklists that I'm sure you know, but there's also checklists for emergencies and trauma emergencies. And there's support in terms of the intensive care unit. There are two areas where the WHO has worked a lot. One of them is the process tools. There are many programs, but the one that's been disseminated is BEC course on basic care of emergencies. This is a very short course designed for first-line responders with limited resources. It teaches systematic assessment to identify lesions which need interventions to save lives. And this is a course that we've been implemented in the region a lot. I will share some of the tools And just for you to have an idea of the scope, the Office of Nursing launched a campaign, BEC 2525, with the goal of providing this course to 25% of nurses and obstetricians. It's very ambitious, but it recognizes how important it is to train first line staff in emergencies. There are other courses, I won't dwell on them right now, as the first aid, community response, basic courses on critical care, and mass victim management. But I would like to briefly share some of these tools of the kit of emergency of the WHO. This kit first has the back course, and secondly, it has the integrated triage tool. This is a tool that was created jointly with different institutions, including WHO, the Red Cross, and Doctors Without Borders, and has 4 versions: adult, pediatric, and pre-hospital and multiple victims. There's a lot of global collaboration. This is a free access tool that anyone can download where you work, at the hospitals, but also WHO and PAHO offers support in the implementation of these tools. It is supposed to be easy to use and always looking to standardize communication between people triaging at the institutions. There are also checklists, as I mentioned a while ago. There's medical and trauma, and the objective of this list is to improve the quality of care. These lists will be filled out once they finish taking care of the patient. I have to verify if an X medication has been implemented. I need not to forget that I talked to the relative of the patient, and this is part of the emergency kit of WHO. And it is also a tool to design a resuscitation strategy. It is important to have a well-delineated area to look after critical patients when they need it. And to finish, these are the key tools in taking care of emergencies, but there are others. I was telling you about the clinical registration of WHO, which is free of charge. And there are other standardized forms that are collecting information, but they are guideline by the guiding the actions of someone who's looking after an emergency, especially discussing what they are doing, if they have provided oxygen, and each part of the clinical care is documented. So when they have been filled out, it facilitates data collection, updating them in the clinical registry, and it allows to add the data to the databases, what's going on with these patients, what we can do to improve their situation, and what's needed. And just to finish, what's the impact of these tools? There was a prospective study conducted in 17 hospitals using these tools in Africa, and 17 hospitals, district hospitals in Zambia, Nepal, and Uganda. You see the numbers on the screen. She's going very, very fast. We are looking for the results of what happened with wounds, asthma, postpartum bleeding, diarrhea, pneumonia, and there was a kit for emergencies, including the BEC course, the triage tool, the resuscitation area, and the checklists. The drop in mortality was impressive, from 33 to 50% in dropping the casualties. This is what we can do if we cover emergencies right. To conclude, there's a lot to be done in the region to strengthen emergency care, but I would like to keep with the idea that there are tools available. PAHO has tools available for this, as well as WHO. They are cost effective. They are not so difficult to implement, and the impact on mortality, as you can see here in the example, could be very, very important. So all of these tools can be implemented without investing too much, not requiring a lot of technology, and they have the potential of saving lots of lives. For this, we are working on a project on strengthening emergency care in the Americas. As part of this project, we are pushing forward the evaluation of emergency care systems and pushing for the implementation of the emergency kit in some countries of the region by promoting the cascade expansion of the BEC course and supporting those countries who would wish to work on this. This is a project where only some countries were included, but the intention is to keep on working to add countries who might be interested in strengthening these systems. And also, we know that not only we are affecting these emergencies, but well, I would like to share some images of the work we've been doing in the region with some countries from 2022 until the end of 2023. And I would like to leave you with the QR code where you can find information about emergency care tools. And well, thank you very much once again, and we remain at your disposal. We would like to thank Dr. Melissa Campos for her presentation, who presented on the tools of WHO PAHO for emergency care systems coverage. Among the different resources she presented, we have those relating to pre-hospital systems, standards for data quality, policies for taking care of emergencies with quality, and also the strengthening of emergency care. Dr. Campos has shared her knowledge on what are the positive effects in using these tools. For instance, the kit that we mentioned, plus triage tools in settings with which are low in resources. And she has also shared on the new project of PAHO. And we wish you lots of success in this project, which is still ongoing. Thank you very much, Dr. Melissa Campos.
Por favor, le invitamos a
Please
permanecer en sala para posteriormente
stay in the room because we will have some dialogue after receiving the questions from the attendees. Now, we would like to welcome Dr. Gaby Lencina. Dr. Lencina is a road safety and mobility expert. She's also an expert in road legislation. She holds a PhD in law and social sciences from UDELAR, Uruguay, since 1993. She's the director of DEMOS, Rights in Mobility and Road Safety. She's a member of REDUX, the Alianza Iberoamericana de Movilidad Segura. She's a specialist and teacher in road safety management ISO 39001. She's been and also is now a member of networks and social movements for road safety. She's a lecturer and teacher in traffic law, road safety and mobility, in technical and legal standards of road safety, in the elaboration and practical training of regulations, technology applied to control, risk factors, the role of communication in road safety, insurance companies, among others. Likewise, she's played a very important role to include in policies in favor of road control agents, police officers, police patrolmen, technical police, as well as advising lawyers, insurance appraisers, prosecutors, magistrates, law students, professional drivers, medical students, professional drivers, physicians in general, communicators, among others. Now, trying to summarize a resume which is as wealthy as hers, I now hand the floor to Gaby Lentina. Thank you very much. Good morning, good afternoon to all of you. It is a pleasure for me to share and have received this invitation from the Andean Health Organization by Maria del Carmen Calle Dávila, the Deputy Secretariat, with her opening words and very good summary that will allow me to show my initial experience, because she has well explained who I am. I would like to thank all of you, the whole team of Horas con Luz. Thank you very much, and thank you very much for the invitation. It is an opportunity to discuss what has to do with the application of technology and control of speed, one of the mainstays where we are focusing on by the United Nations, because this is a weakness that we have in our countries, in the countries of the region, in what refers to having legislation. We've already taken some steps. There's been progress made. Now I will share the presentation, but we also have some important challenges.
¿Se ve bien ahí? Sí.
Can you see my screen? Yes, yes, we can. Well, regarding the world situation, the idea is to show this slide, which makes and showcases what's the concern that existed at some point in time at the world level, even because of the losses of lives in accidents. From this report sent to WHO, we have plenty bibliography and data and diagnostic tools, and we have now shared those initiatives which have been proven successful and with scientific evidence. Since then until now, we have a wide array of support material, very specific material, even for the leaders, for those people who have to work on the policies. So we do have tools and scientific evidence, and from 2004 onwards, the paradigm changed at the world level, because we are no longer discussing fate or things that happen by chance. This is scientific evidence, having data, reliable data from transparent sources and the different risk factors, a comprehensive approach towards the existence of comprehensive laws as well. And as the speaker said, we are all discussing concepts which have been, now we are no longer speaking about accidents, because this is not something that happens by chance. They are avoidable and they are predictable. So in everything that has to do with these topics, safe systems and the evolution, and where the 2015-2030 agenda comes in regarding the SDGs, there are 2 points, 3.6 and 11.2, that relate to reducing the number of losses. And same thing happens with 11.2, dealing with transportation and the mobility of vulnerable people, women, children, people with disability, and the elderly. In Stockholm, the declaration that happened, these commitments in the 2030 agenda were linked to this second period approved by the General Assembly, which proposes the reduction of 50% of fatal victims, focusing on reducing the limits, on the speed, sharing spaces with vulnerable users. The World Plan has some highlights to mention. One of the aspects that it shares is that road safety is now at a crossroads. This is a time where we really define if we continue talking about this in our countries, about the loss of fatal victims and wounded as something natural, or as a situation that we are embracing rather than actually challenging this reality and wondering what to do despite of the progress that's been made so far. An aspect that the World Plan highlights is that this should become a fundamental value. This is not something minor, and this is why I'm bringing this to the conference. Road safety in many of our countries does not have this value that it should possess to really consider how important it is. The WHO reports discuss about a reduction of the regional and world rates, and we see that there's been an evolution. And now, in the 2023 report, reflected on the WHO website, that 1.19 million people die in traffic accidents. More than half happen with cyclists and pedestrians. In this report by WHO, there's reference made to 15 people who die every 100,000 inhabitants. We have to also highlight the role played by the users of two-wheeled vehicles, accounting for a very important percentage of deaths, while many accidents happen with other types of vehicles. 92% of the deaths happen in countries with low and medium income. This also has to do with the fact that the risk of dying is threefold higher in low-income countries than in high-income countries, despite these countries have less than 1% of the motor vehicle fleets. This is an expression of the concepts of social inequality that road safety has, from the exposure to risk of groups of people in countries. This is also broken down by age and gender. There's no direct relationship between an increase in the fleet and the number of accidents. The data indicate that if we have 52% in the graph to the left, this is something that's confirmed by the reports. If 52% of the vehicles at the world level reflect or have 8% of deaths, but at the same time in low-income countries, 42%, 9% of the number of vehicles reflect 42% of the number of losses, this myth will be automatically reduced. Not because we have more cars, there will be more losses or accidents. In the region of the Americas, from 2013 onwards, there's been a drop in the regional number. In the Andean, in the 2019 report, if it's true, this is a 2016 graph, there's a reduction in the regional rate as well as in the areas. This is also reflected in 2019's PAHO report. We see that there has been a minimum reduction. If we were speaking about stability at a certain point in time or something like that, there's really a reduction in the percentage. We have the WHO report to prove this. How do we tackle road accidents? This is the world framework from where all the provisions have come out. We know that this has different causes, different approaches, different actions and initiatives. And it also has to do with education, public safety, mobility, equitable access, social inequality, coexistence, government, environment. We understand that definitely this has to do with human rights, because we are all inhabiting the planet and we have the right to use shared spaces like roads in adequate conditions, where we can share, having oral potentials prioritized. So this is a matter of rights, universal rights. Regarding this public health problem, 2004, the forecast as at 2030, in the 9th place. If we did nothing, we would be on the 5th place. Now, with the 2023 report, we identify road accidents in the 12th place, but the first one as cause of death in groups aged from 5 to 29 years of age. Well, we have a world plan. This plan identifies from safe road systems what are the measures that we have here. We heard about it in Melissa Campos' presentation. We are including safe vehicles, infrastructure, and how to apply this. We have Well, and I would like to stop here because this has to do with the presentation and the other aspects, like speed management,
Está indicándonos dónde tenemos que
is
trabajar.
something that's indicating us where to work to have immediate results. The use of technologies and who is responsible for this. It's the civil society playing a fundamental role, has been essential in supporting actions and initiatives which have bear results in our countries, and they've been keeping policies which were maintained and at risk of disappearing in the event of a change in the administration. We have identified multiple challenges. They have to do with guidelines which are not good enough. It has to do with some aspects as to how we promote walking, how to walk, how we displace and ourselves in a city in a safe way. And a noteworthy aspect is that 25 countries are demanding psychological assistance to the victims of traffic accidents. Well, if we work on risk factors, we know what's this all about, but we need to have standards and rules and laws to comply, something that's being requested from the WHO and the United Nations, and that is the effective application of the law. Law enforcement. This been included in all the reports to strengthen the application of the law, PAHO in priority measures discusses this topic on applying the law. And I would like to dwell on the last point, which is setting a specific organization in charge of law enforcement, training and guaranteeing the adequate team for the activities of law enforcement. This is something that's actually lacking because we are dragging from oversight practices, old-fashioned practices, which have been around for a long time. And now, with the incorporation of technology, we're lagging behind a great deal. And we now have to reassess these roles. Especially, we need to try to pursue these objectives to reduce losses and accidents. I wanted to highlight this because law enforcement has a direct impact on the control. So what are the practical criteria that at the level of the WHO refers to the optimal legislation or practices? This is based on what we've analyzed and researched on. I would like to stop on speed. We need to have a law at the national level, a law that will set forth the maximum limit in speed is 50 kilometers per the hour or less in urban ways. And the third aspect, that is that the local authorities need to have powers enough to modify and reduce the speed limits fixed at the national level if there's 20 or 30 or less. What does this show? This I will go fast because this has to do with different risk factors. But first, we have alcohol. Then we have alcohol content, the use of a helmet. This is Uruguay, which as by 2022, they are reporting that not all of the requirements have been complied with. And this has to do with data dissemination. Uruguay authorized the use of helmets and with technical standards and the prohibition of imports of helmets without technical certification.
que en el 2019 se incorporó en la última ley nacional.
So this was incorporated in the last law,
El debidamente abrochado que requieren los cascos y bueno, prontamente seguramente
and
esa
I'm sure
incorporación de Uruguay entre
that
los países que cumplen los requisitos
we
en
will
materia de
incorporate this in those countries which are missing. So we will now move to speed. This is the mapping. This could be some differences in the organization of the information, and this is what I just told you about good standards regarding this speed criteria, national law with a maximum limit not more than 50, and the fact that it might be modified locally. So what's the conclusion of this? It's the most positive changes in the behavior of the users. They happen when the legislation on road safety comes along with law enforcement and awareness campaigns as well. The law alone is not enough. And if we don't have it, even worse. The law requires other applications. And also an integrated legislation has to be the guarantees given to the pedestrians and the citizens at large have to be guaranteed, as well as other systems. Equity and equality when it comes to legislating is something else.
Inequidad social son distintas a cómo podríamos estar.
And these measures could be different depending on where we are.
Siempre la protección de los derechos y la garantía de los
Always
ciudadanos.
bearing in mind the protection of human rights. What about the control approach? We say that the practical application of the law suffers from a problem at our countries in general. If we talk about technology application, this depends on who's the authority in charge of controlling road safety and the use of technology, and also facilitate this from the monitoring viewpoint, from the, well, we have tools to be promoted. Different things happen here. In order to have an effective implementation of the law, we need to have the political will backing this. This is not a company. This is political will that is needed for the observancy of the road laws. And the authorities in charge of law enforcement should have enough resources to prepare activities accordingly. We are discussing political will here and giving the power and the human resources, but there needs to be sustainability, and they should come with measures and sanctions whenever there's a non-compliance. If we have a law and we start disseminating this law, but this does not happen at the same time with penalties, I don't think this would work. An important aspect, which is highlighted in the reports, is the importance of raising awareness amongst the people at large. When they understand that this is a measure that will save their lives, this will work. And from there, we will have an already paved road that is something that will turn into the best equity that we can have. People knowing that there's a systematic risk factor, that there's a situation that put their lives at risk, and that they should
contra la seguridad vial. Por eso es importante
be aware of
ir
this,
haciendo de forma paulatina, pero en forma
building little by
coherente
little
y
and
de
bluntly
forma
all of this
responsable
awareness
a
and
la
sustainable
factores de
awareness
riesgo, por ejemplo, ¿sí?
for them to
El
know what are
safe
the risk
control
factors.
seguro
What is
control
a safe
eficaz.
control approach?
Esto debería primar en toda concepción de fiscalización, no importa si es enfoque en base a presencia de recurso humano o en base a tecnología.
So
El procedimiento seguro o el control seguro
the
atiende
safe
a la
control
seguridad, perdón, de todos los involucrados al momento del
depends on everyone who's involved at the time of control, the user, the traffic, and the institution
mediante la figura de autoridad, mediante el control en base a tecnología,
represented by an officer, and if the control officer is, of course, there, it should include the safety of these people as well. So something that refers to oversight has to do with sanctioning systems, and sanctioning systems have not a very good press, so to speak. This is associated to high political costs and the fact that controls or might not be adequate when there's a change in the administration. This is something real. This is something that we all witness, when we should actually work on adding to the value of control and oversight. So we have to work on strengthening the authority policies. And as I was mentioning before, we should also work on the capacity building, clearly understand what's the vision and mission. Forget that we are trying to collect something here. Clearly understanding that we have to work based on law principles, transparency, good faith, so that the citizen will have all the information necessary and will see that this is not just to collect an infraction, but rather for prevention purposes.
Control tiene como base la prevención de que
Prevention is always at the heart of these actions. Prevention of accidents, prevention of losses.
La gestión y planificación del sistema de control en base a datos.
Data-based control management. This is something that's based on technology and training and results. And a very important aspect here, absolutely important, has to do with the sanctioning process that we have installed in our countries from the administrative standpoint. Many times, this has to do with economic resources, infrastructure, and sometimes the consequence of the sanctioning process is being discussed, and sometimes this process won't work. We have safe procedures, control safe procedures. I could dwell, but I don't think I have enough time to do so. We said that we have tools, that we have standards, we have data for the management. We are supposed to have data in order to manage something.
Normativo de reincidencia. Con esos datos nosotros podemos trabajar en una cantidad de conductas que se
So
pueden.
we will work on certain behaviors which might be avoided or prevented, modifying or trying to look for other strategies instead before applying a sanction. We should have resources and technologies. We need to have technical standards. The processes need to have a regulatory framework with very good technical standards and technology. Those that work globally and not supposed to produce a reaction from the user, thinking that this is not adequate. The role of the traffic agent, this is something that Pierre Navarro was mentioning on his interventions when we discuss a given oversight action focused on a risk factor we should be using from the very moment of communication. We should back all of this intervention in the street with the traffic agents. Road safety is a value and has to be protected. The effect of the deterring effect, it not only relates to the person who's committed some action, but it has to be disseminated to the people at large, so they will know what comes next. This has to do with the necessary perception of control. In a workshop in Buenos Aires, wondering what happens with control aspects, all of the countries identified the same things. There's conflict of competencies many times because we have competing authorities. And they work at the same territory. Sometimes this is not under their jurisdiction. We also have a deficit in control and observation. We don't have enough databases, and evidence-based planning is not a reality somewhere, some of these places. We mentioned a while ago that technology comes very at hand, but also it challenges us. It's a challenge opening a possibility to analyze this risk factor or the incorporation of technology to control speed and analyze all the administrative procedure. And here we detect that we have failures and faults. An important aspect here is that speed is a first level, and this has to do with risk factors, of course, but we know that minimum reduction is proving to be very effective.
También sabemos que fijar los límites de velocidad adecuados a la función que cumple cada vía de tránsito y hacer cumplir los límites de velocidad no se acaban ahí, sino que tenemos que tener.
So we have to, first of all, build or modify adding characteristics that will change traffic. The technology should be an integrative part of the vehicles, and we have to raise awareness on the effect of exceeding the speed. So speed control is much more than saying we will control the speed. It has to do with different strategies to integrate technologies. The message by the WHO in a 2017 report is that excessive speed is illegal and unacceptable. We see here the different types of monitoring that we can have. The monitoring for the distribution and control of traffic flows and time and space with a goal of preventing accidents, direct control measures through fixed or mobile cameras, and indirect control measures as well.
emergente, limitador de velocidad, freno autónomo de emergencia, entre otros.
And
Y
among
tenemos
other
algunos de los
things in the
ejemplos,
region, we have some examples which
realizados
have
con campañas de
included
sobre el factor de riesgo de velocidad, como en
campaigns
Colombia.
on
También
speed.
tenemos
We have some
por
campaigning
ejemplo,
in
Chile,
Colombia,
que
in
ha acelerado
Chile,
el desarrollo a nivel
with the whole
de
development
sistemas
of
para que
these
otros tengan
systems
fiscalización eficiente. Tenemos varias ciudades
to have
capitales
effective
que han
control.
logrado implantar zonas 30.
We have
Y
also
también
applied
la sensibilización sobre el efecto de
30-kilometer
ese
areas,
les
and
dejo acá un
I
enlace
will now leave
la
you
guía de
with
buenas
a
prácticas para el control y la reducción de la velocidad en América
link
Latina, de un
that you
proyecto
can
que
read at
fue
your leisure.
uno de los proyectos que fue
This was one of the projects
respaldado por Naciones Unidas
that was
en
supported by the
2020,
United
se hizo todo
Nations in
frente a
2020. It
Ecuador,
was developed
donde el trabajo fue en Argentina y tenemos algunas de
here,
las
and
conclusiones
we
de
have
la pequeña placa,
some
pero además les pongo el
conclusions,
enlace a los efectos de
and I
diseño
will share this
y
link
poder tener un paneo de todo lo que
just
pasa
if
y
you
que pasó
want to have an idea of what
en
happened
Latinoamérica en
in
varias
Latin America in
intervenciones
different
y por eso la gente se interesó a través de
interventions
esta guía por parte de, bueno, el equipo y dirigido por la directora ejecutiva Ana
by the
Ferrer.
team.
Uno de los aspectos que destaca en esta frase es
One of the
que
aspects highlighted here is that the most advice lines by multilateral agencies is the surveillance and control actions. But this is a measure which is somewhat complex. This is especially true in Montevideo. When we talk about this experience goes back to 2013. If we analyze, well, whenever effective measures are implemented, they of course prove to be effective. To finish my presentation, the big weakness in the region is the inadequate application of the law. We have a defective law enforcement and also in terms of the oversight we conduct. When the penalties start to be applied, modifying the system, the traditional system, this is only when we have to make sure that we have updated legal measures, avoid applying old-fashioned standards. This will contaminate the whole system. And citizens detect that there are defects or mistakes, and they use an implementation of an efficient audit system or oversight system is essential. It should provide all the guarantees needed, and it makes the law to be complied with, and it is also a safeguard. Thank you, and a lifesaver.
Muchas gracias, estimada
Thank you
doctora
very
Gaby
much,
Encina.
Dr.
La
Gaby
doctora
Encina.
Gaby nos comentó en su
She's
presentación
mentioned
acerca
throughout
de
her
la situación
presentation
mundial de la
about the
siniestralidad
world
vial,
situation of
en la
road
que
accidents.
actualmente contamos con diversos
We have
desafíos, entre
different
ellos,
challenges
por ejemplo, que casi el
to
80%
tackle.
de las
Almost
vidas
80%
trabajadas
of
a nivel mundial no cumplen
these
con
does
la
not
calificación
comply with
mínima
the minimum
de 3
qualification
estrellas para la seguridad
of
vial en
3
la actualidad,
stars
y que el
for
0,2%
pedestrian
de las vidas
control,
salvadas
and
carriles para bicicletas. Pues, es un
so
gran
this
desafío tanto
is
para la
just a
seguridad
big challenge
a
both
nivel vial
for
como también para
road safety and
la
also
propuesta de un tránsito más sostenible.
this proposal towards a more
Asimismo,
sustainable
la doctora
traffic.
Gaby nos mencionó
Dr.
acerca
Gavi
de la
mentioned
importancia del
also
adecuado
about the
control a
importance
partir
of
de la
having adequate
legislación
control
y la
stemming from the
fiscalización,
legislation and
ello
oversight
con enfoque de
actions
salud,
with
seguridad, justicia
an
social y
approach
sostenibilidad.
towards sustainability
Asimismo, nos mencionó
and
acerca de
legal
herramientas
justice
tecnológicas,
and technological tools
entre
that
estas
she
mencionó
also
la
mentioned.
asistencia en los vehículos,
early warning systems in the vehicle, and some other measures to control speed through fixed and mobile cameras. An important piece of information is that dropping 5% average speed might result in a 30% reduction of mortal accidents and crashes. And Dr. Lencina has shared on the good practice guideline for the control and reduction of speed. And thank you very much for your presentation and for sharing the link with us, which no doubt is important in the region. Dear Dr. Gavi, once again, we would like to thank you for your presentation. We have received lots of questions, and we invite Dr. Melissa Campos to stay in the room, since we will start some dialogue after. Now we will have an active pause. After these moments of learning and knowledge exchange, it is essential to take some time to relax and start a mini physical exercise session. Please go ahead with the active pause now. And the Horas CONU will encourage the well-being of those who accompany us in this virtual session. We would like to stay healthy, combat stress, reduce work fatigue, and keep our muscles flexible and healthy.
Buenos días, buenas tardes, desde cualquier parte del mundo, donde quiera que te encuentres, bienvenidos a realizar esta actividad saludable. Así que desde el Organismo Andino de Salud, Convenio Hipólito Unanue, los invitamos a participar en esta actividad divertida. Así que vas a tomar una hojita de papel, preferiblemente reciclado porque somos amigos del planeta, y vas a realizar una pelotica de papel. Pelotica de papel, vuélvela una pelotita antiestrés. Y hoy vamos a trabajar esa liberación del estrés y la agilidad. ¿Cómo estás de agilidad? ¿Trajiste la habilidad del día de hoy? Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela hoy trabajando juntos desde la agilidad para hacer esta actividad saludable. Así que nos fuimos. ¿Tienes tu pelotita antiestrés? Empiecen a lanzar, que toque el techo de donde estás. Vamos, láncela bien alto, arriba, arriba, arriba. Perfecto, domínelo. Cuando la tenga ya dominada, así que quiero que miren, lanzo, aplauso, recibo, lanzo, aplauso, recibo. ¡Nos fuimos! Largo, grande, amplio, generoso, y no se te olvide la sonrisa. Eso es, lanzo, aplauso, recibo. ¿Qué tal si me regalas 2 aplausos? 1, 2, 1, 2, 2 aplausos, si se puede. 1, 2, domínalo. Si se puede. 3 aplausos. Perfecto, 1, 2, 3. 1, 2, 3. Si se cae la pelotica, la recoges y sigues. ¡Vamos! 3 aplausos. Vamos a romper el récord en el Organismo Andino de Salud. ¿Cuántos aplausos eres capaz de dar? ¿Listo? Lanzo, lanzo. Cuente, cuente, cuente. ¿Quién tiene el récord? ¿Quién tiene el récord? Perfecto. 4, 5 aplausos. Los que alcance a hacer. Esa es la actitud de energía positiva. Excelente. Vámonos, fuimos. ¿Cuántos aplausos fuiste capaz de hacer el día de hoy? El profe va como por 4 aplausos. Muy bien. Excelente. Lanza la pelotica. Con tus 2 manos te vas a tocar la cabeza. ¿Listo? Mire, lanzo, toco cabeza, agarro. Lanzo, toco cabeza. Con ambas manos. Perfecto, domínelo. Esa es la intención, esa es la actitud. Están demasiado coordinados y ágiles ustedes, así que cabeza a hombros, mire. Cabeza a hombros, agarro. Lanzo, cabeza a hombros. Coordínense. Si se puede. Agilidad. ¡Ánimo! Perfecto, necesito saber quiénes son los más coordinados del Horas CONU. Si se puede. 3, 2, 1. Y sabe que vamos a agregarle un tercer ejercicio. Yo creo en ustedes. Vamos a hacer cabeza, hombros, aplausos. ¿Listo? Lanzas la pelotica, cabeza, hombros, aplausos. No se rinda sin intentarlo, no fuimos. Cabeza, hombros, aplausos. Si se puede. Cabeza, hombros, aplausos. Eso es. Domínenlo conmigo. Sí se puede. Energía. Cabeza, hombros, aplausos. No se rinda. Rendirse es para otros, no para nosotros. Esa es la actitud. La gente del organismo andino de salud. La más fuerte, la más valiente. Esa es la actitud. Los que no se rinden. Eso. 3, 2, 1. Perfecto. Último. Cabeza, hombros, aplausos. Agárrenlo. Muy bien. Excelente. ¿Cómo estamos de coordinación y de descoordinación? ¿Vamos bien hasta ahí? Perfecto. Lanzo la pelotita. Voy a hacer un aplauso, pero lo voy a hacer detrás de la espalda y agarro. ¿Listo? Entonces hay que hacer ágil. Revisa tu espacio, que no te vayas a pegar con nadie. Eso es, con nada. Muy bien. Lanzo, aplauso atrás y agarro. Si se puede. Lanzo, aplauso atrás, agarro. Vamos. Energía. Aplauso atrás y agarro. Si se puede. Lanzo, aplauso. Perfecto, domínenlo, regálenme 10 de sus movimientos. Yo voy 5. ¿Cuántos le quedan? 4, 3, 2, perfecto. 1, energía y descanso. ¿Qué tal si hacemos aplauso adelante y aplauso atrás? ¿Listo? Sí se puede. Vamos. Voy llenándonos de energía hoy. Esa es la actitud. Entonces, miren, lanzo aplauso adelante y atrás. Adelante y atrás y agarro. Adelante y atrás y agarro. Sí se puede. Vamos. Energía positiva para todos. Perfecto. Adelante y atrás y agarro. Adelante y atrás y agarro. Si se puede. Domínenlo. Esa es la actitud. Esa es la intención. Perfecto. Energía. 3. Muy bien. 2. Muy bien. 1. Último. Y agarrar la pelotica. Esa es la intención. Esa es la actitud. Bueno, me dicen que Bolivia, Chile, Colombia, Ecuador, Perú, Venezuela trabajan juntos desde la coordinación hoy para llevar hábitos de vida saludable. Y muy importante, no hay que rendirnos, ¿cierto? A veces parece difícil, pero no lo es si le ponemos actitud. Último ejercicio, vamos a hacer el último. Quiero que tomes tu pelotica. Mire lo que vamos a hacer con ambas manos. La vas a acercar a tu cuerpo, vas a soltar la pelotica, le vas a dar un rodillazo. Perfecto, y la pelotica va al aire y la coges. Uy, profe, eso suena muy difícil. Realmente suena más difícil de lo que en verdad es. Usted lanza y agarra. ¿La tiene? Perfecto, mire. Perfecto, que rebote. Que no se caiga. Si se cae, la recogemos. No pasa nada. Eso es. Rebota en la rodilla y la agarras. Sí se puede. Muy bien. Cuando domines la pierna derecha, quiero que lo intentes con la pierna izquierda. ¿Listo? Sí se puede. Vamos, coordinados. Sí se puede. La otra piernita, ya. Muy bien, suelto. Perfecto. Rodillita y la agarro. Ahí les vamos dejando ese ejercicio de tarea a todas las personas del Horas Cono para que trabajen la coordinación, la agilidad. Muy bien. El dinamismo. 3, muy bien. 2, excelente. 1, perfecto. Y descanse. Muy bien. Excelente. ¿Cómo nos ha ido el día de hoy? Como siempre, un estiramiento para liberar las tensiones de nuestro cuerpo, llenarnos de energía. Quiero que cojas la pelotita con ambas manos. Perfecto. Sube los brazos todo lo que puedas. Separa las piernas. Estírate, estírate arriba. Eso es. Sonrisa. Mire, nos inclinamos para un lado, estiramos la espalda. Perfecto. Liberamos estrés, tensiones acumuladas, nos llenamos de energía positiva, vuelves al centro lo más arriba que puedas, vamos para el lado contrario, eso es, y respirando siempre, respiración, algo súper importante, estiro, 3, 2, 1, vuelvo al centro, tomo aire, exhalo y bajo los brazos, calorcito, energía, fuerza. Mire, hoy desde el Horas Cono les agradecemos de todo corazón haber estado con nosotros en esta pausa activa, saludable, divertida, y los animamos a seguir haciendo ejercicio de forma activa. Organismo Andino de Salud, Convenio Hipólito Unanue, un abrazo para todos. Chao, chao.
Excelente. Esperamos que esta haya sido una pausa activa muy provechosa para todas y
We
todos.
hope you enjoyed this active pause. Now, we would like to thank all the people who's connected from the academia, Ministry of Health, various entities and social organizations, and she's mentioning all the countries.
Guatemala, Inglaterra, México, Nicaragua, Paraguay, Perú, Uruguay, Venezuela, entre otros. Hemos recibido muchos saludos.
We have received a lot of greetings, and we thank you for that very much. To start this dialogue based on the questions raised, I would like to ask the speakers to please turn on their cameras. During the development of this webinar, the participants have left some concerns, and we will do our best to answer most of them. So we will follow the order of the presentations, if you agree. I would like to invite Dr. Melissa Campos to answer the next questions, and also Dr. Gaby Lencina, if you would like to build on Dr. Melissa's answers. The first question is, what alliances should be built from the health sector to train people on first aid in the community? Thank you very much, Ruby, and thank you very much to the audience. This is actually a very important question, I think, because it build capacity, especially in the community, but in general of all the people in the health sector, requires interinstitutional cooperation. Oftentimes, this incorporates agencies from the ministries of health, academic institutions, hospitals, or service providers, and specifically it involves police corps or something which is also important when it comes to providing first aid in the community, is to make sure that the first responders have been coordinated to enter the emergency care system. It is very common to give training on first aid massively, openly, but unfortunately, this not always will have an impact. Whenever there's more impact is when the first responders have been trained and have an effective response together with the rest of the system. Thank you very much, Dr. Gaby Lencina. Would you like to add anything? No, I think I'm okay. So now we'll move on with the next question. What would a Good Samaritan law be about? That's an excellent question. Also, there are different laws. There are different currents and different perspectives and Good Samaritan laws. Each country has its own priorities, and there are countries which develop it in a certain way, and there are some others differently. The most important response, I think, is that there's no specific law that will apply to all of the regions and the countries, but the goal of such a law is to prevent people having training on first aid and having the chance of being close whenever there's someone injured, preventing them from feeling limited to act because of the legal consequence. Unfortunately, this happens. There are many examples in countries of all the region where this has happened, where someone trained is not doing or is not providing the assistance needed, or having someone giving the assistance and suffering legal consequences afterwards. This happens. Okay, thank you very much. Next question, how are information technologies contributing to the strengthening of integrated health services in emergencies, critical care, and also what are the challenges out there in the optimization of their use and their results? Thank you very much. I think that this is an extremely wide and broad question. We know that the incorporation of technology could be present from the hospital with the health systems and the clinical charts and data registration systems. It plays a fundamental role in the communication between agencies and between hospital institutions and pre-hospital emergency services. There's also an important role in geolocation services, especially whenever it's about emergency calls. One of the things that we always ask at the call reception center if they have geolocation services, because it might work faster when the person is injured. So the potential in reducing times, both in terms of the arrival of the emergency unit and preventing the units, if we had effective communication in taking one hospital to another, much of time will be saved and we will avoid having delays. But the challenges are many, starting from the financial challenge in technology application, going through the challenge of having trained staff. They should be acquainted and also change, adoption of change. Some processes which have been conducted in a certain way without technology, now they will incorporate technology. And remember that there's always resistance to change. So filling the forms is also something to consider. Always changing generates resistance. So the spectrum of the benefits is very broad, but also the challenges are broad. However, the potential impact, I think, is very essential to consider. An example is that PAHO has a system to support pre-hospital emergency systems. And this is a system that is offered for free. However, it has not been implemented so broadly. Thank you very much. Now, let's move on to those questions addressed to Dr. Gaby Lencina. What are the main investments to strengthen road safety in the Andean countries? Investments, you mean economic investment?
Obviamente que depende de cada
It
país
depends on each country, of course, and how each country has been facing the situation. The approach is different. There are countries who do not have funding on road safety. This is a flaw. It is impossible or very difficult or very hard to generate different strategies without having resources. So we should have resources, or at least what PAHO indicates in the priority measure report is an organization having resources for effective control and oversight with all the guarantees included, and it should eliminate these shared competencies that sometimes generate a lot of difficulty because they are applying different criteria, and an agency which, if we talk about a country, if it's a regional space, it would be more of integration that is needed, where the challenge is to try to foster in the region the use of basic protocols and parameters. If I start analyzing what is necessary in each country, I would devote them on good control and oversight. Thank you very much. Now, There's another question
¿Qué estrategias
for you.
serían eficaces para
What
una
strategies would be effective
fiscalización que
in
sea
having
sostenible,
sustainable
ética,
oversight
¿no?
and
Ya que
ethical oversight as well?
se ha extendido en muchos países es el de la corrupción, por ejemplo.
You know that corruption is something that we all share. We have that in common
Cercanos a la
among
Comisión
the
Nacional de
countries.
Fiscalización.
So,
Adelante,
Sí.
querida doctora.
Sí, esta
well,
es una dificultad
this is a
clara,
difficulty
identificada.
that has been clearly
Se precisa,
identified.
bueno, primero,
Well, first,
formación cuando existen agentes de control. Por eso es que
when
son
there
necesarias
are
las
control
tecnologías,
agents, and this
porque
is why
encima
sometimes we
muchas
need to
veces
resort to technology.
gran parte
Think
de los
that
sistemas
many
de decisión
times
de
countries do
implementar
not make the
fiscalización
decision of
se asocia a
applying
esa
oversight because this is
corrupción o a esa
associated to
posibilidad
corruption,
de
to this
y por eso cuando esa
possibility
tecnología
of
fría, automática, que está ahí separada,
like it's cold or
de
automatic
cualquier manera
oversight, but
existe esa tecnología que hace
this
esa control
technology,
después es valorada por
it
seres
is
humanos,
then
profesionales,
valued
humanos.
and assessed by human
En
beings. Well,
un país,
definitely,
concepto que no es generalizado en la región, este concepto,
this
pero es
concept
una
has not
realidad
been
en
generalized, but
países.
this is a reality in some countries.
Las
So
estrategias
the
es
strategies
bueno,
are
tiene que
first,
ver también con
this has to do with
como
strengthening.
perdón, digo, pero
Well,
hay que decirlo
I'm
todo,
sorry,
¿no?
but we have
Hay
to.
un tema de
Well, there's
políticas
also an
que están
issue
vinculadas al control
that has to
y
do
tienen
with
que
the
estar
people related to
debidamente
control. They
remuneradas,
need to
porque si
be
no,
duly remunerated. They will have to
estamos
be
ante una
paid
situación de
accordingly
comité
because there are
que
some
trabaja
situations
con una
associated
digamos,
to
con una valoración de su
uh,
tarea
the
menor, hablando de una tarea que está expuesta al riesgo.
something that is
Ahora,
exposed to risk.
necesariamente tiene que ir de la mano de una concepción ética
This
desde la cabeza,
has
desde
to
la
go
gestión. ¿Por qué? Porque tiene que ver
hand
con
in
el
hand
diseño
with,
de la estrategia de
well, it has to
fiscalización.
do with
Si
how
una
I
estrategia
think
de
about
fiscalización,
the
porque
oversight
quiero
strategy.
recaudar, porque me
If
están
I'm
diciendo que
thinking
recaude,
this
entonces
just
mi
because
cabeza
I need
es
to
otra.
collect
Entonces,
money, I'm using a different approach,
ahí
but it
lo que
is
quiero
just
es
about
evitar que la
preventing. I would
persona
like
cometa esa
to
infracción.
prevent
No quiero
people
generar
from
culpadas
committing this
a que
sort
cometa
of
la infracción.
things.
Entonces, en velocidad es un ejemplo claro.
So this is
¿Por
just a
qué?
clear
Porque esto
example that
tenemos
we have with
planificado
speed
desde hace
control.
2
We need
años.
to have
Esto lo ideal sería a nivel
protocols
regional,
out there.
a nivel de toda la región. O sea, que nosotros podamos tener parámetros que
We should
sepamos
follow parameters that
no
we
a nivel
know,
del país.
and
Después,
this
si uno
happens at the
determinado
country
a nivel
level.
gobierno, departamento,
At
provincia,
a
tomamos una
given
forma
province or
de regular,
department,
controlar y
we
otra nos va a ser
have one way of controlling, and then we have another one somewhere else.
como ciudadanos el
This is
cumplimiento de la
this
fiscalización.
is
Si a eso le
affecting
sumamos situaciones que son
our
injustas,
idea of
por
oversight.
ejemplo, en velocidades, claro, si ubican un radar
If
algo
there's a
viene atrás,
radar after a curve,
entonces lo que está
the
pasando es que
what
no
is
lo se ve.
happening is that
Entonces,
I'm not
la
seeing this,
situación
but
es
this is not
de
the
la persona
concept.
que
The
desde
concept comes
la
from good
ética,
faith, from
desde
the
la
ethics,
transparencia, desde que quiero cuidar que
from
realmente
transparency,
no
where I
cometa esa
really
infracción. Evidentemente que
want to
esto es un
avoid
cambio cultural,
this
y más para nuestros países, porque nosotros
non-compliance.
por nuestras historias desarrollamos una serie de
And this
conductas
would mean a
que al
change in
sistema seguridad
mindset,
vinculado al tránsito
especially in our
le produce
countries.
absoluto descreimiento, o sea, violar las normas de tránsito
Violating
está rankeado,
traffic
incluso
standards has been even
las normas
ranked.
más
This
incumplidas o las
is
normas más incumplidas.
something that we
Entonces, esto
mostly
es
non-comply.
se tiene que transformar en un
We
valor, pero
have
también tiene que haber
to
una
think
conversión
about values,
de
but also
los gestores,
a
de
conversion
los
from
decisores.
the managers, from the
No puede
decision
ser,
makers.
y nos ha pasado, y puedo hablar porque es de mi país, decisores que de repente el planteo que
There
se
are
hace a las poblaciones
decision
no
makers
cumplan con el uso del casco o no cumplan
who
con que no va a controlar el consumo de alcohol. O sea,
say
cosas
that
que
they
no
won't
son así,
control alcohol
poniendo de parte
consumption or the use of
el sistema de
helmets.
control. El sistema de control. No sé si
This is
respondí, pero en
having the
definitiva,
system
para
at
mí que la
crossroads. I don't know if I
formación
responded, but it has to do with formation, with good payment, but
desde el cambio
this is a
de cabeza de
top-down.
quienes están
This is a
definiendo las
top-down
políticas.
approach from those who define the policies.
Muchas gracias, doctora.
Thank you
Una
very much.
última pregunta dirigida a usted es,
One last
¿cómo
question
la
is
inseguridad
how
vial se está relacionando con el cambio climático?
is road insecurity being related to climate change?
Se toca en muchos temas.
Well, this is discussed in
no
many
solamente, pero
places.
se toca en el tema,
Well,
se toca en el transporte, en la movilidad de las personas, y
it
sobre todo
is
en la movilidad de
something
las personas
that has to do with people mobility
en transportes que no tienen, o sea, que no están,
in means of
porque,
transportation.
digo, depende del país. Hay
Well, it
países
actually
que
depends on the country.
está ya, digo, hablando siempre de la región, ¿no? De
And
nuestro
I
país
always
sobre
refer to the region.
existen países que están realizando
There are
digamos,
countries
ese cambio
who are introducing this
de, digamos,
change
del uso de combustible por medios
in
sostenibles
use
a tratar de
sustainable
buscar
fuels
contaminar más
and
y
trying not
reducir
to
las emisiones.
contaminate and reduce the
Vinculado a la
emissions.
seguridad vial, eso hace que
But this
nos pongamos a pensar en
makes us start
ciudadanos
thinking
que
about having
se
citizens
trasladen en
who
vehículos,
would
digamos, que
move
sean amigables con el medio ambiente.
through environmentally
¿Qué pasa con
friendly
esa
vehicles.
política?
What
En
happens with
realidad,
these policies?
la estimulación del
In
uso del
reality, the
transporte
encouragement of using
en
different
líneas
means of
de traslado
transportation
en vehículos de transporte de pasajeros es lo que nos puede asegurar el
is
menor
something that can
traslado por velocidad, por distancias, ¿no? El menor traslado en vehículos
ensure
individuales, y eso hace que
that people will
entonces
no longer
disminuya
use
esta
individual vehicles, thus reducing this
Si
contamination and
hablamos
pollution.
o sea que en vehículos, es claro, vehículos eléctricos o vehículos
Electric vehicles are an alternative, of course, and this is very
que
clear.
aseguren esta sostenibilidad
Vehicles that will ensure sustainability.
En materia de lo que hace, por ejemplo, a vías, a infraestructura,
Regarding the infrastructure,
podemos generar otro tipo
we
de
can
ámbitos
generate
que
other
es
types
habrá
of
distintos
things
espacios viales
where we will
de
use
ciudades mucho más
spaces
amigables con
which are more
paisajes
friendlier
coherentes,
or
amigables
with the
que nos
trees
posibilite la
or
integración
things which might
de personas
facilitate the
ancianas, de
integration of
niños,
the
en
elderly,
espacios en los
elder
cuales
people or
hoy está
children
siendo,
in
por ejemplo,
places where
solo usado
right
por
now this is only being used
de
by
cuatro ruedas, por vehículos de transporte de cuatro
four-wheeled
ruedas.
transportation means.
Bueno, me quedo medio por ahí.
Well, this is it.
Muchas gracias. Tenemos
Thank you
más
very
preguntas
much.
para
We
ambos
have
ponentes,
more
por favor.
questions for
El tiempo
both
lamentablemente
speakers,
no
but for the
podremos
time
abordar,
that we
pero
still have left,
estamos
we
pendientes
won't
en
be able
enviarlas
to cover them, but
para
we will send
comenzar
them,
futuros diálogos
maybe to
y también
foster more
compartir
dialogue, and
unos buenos recursos para
this will
próximos
be
webinars en el Orascom.
good food for
Eh,
thought for
Reiteramos
coming
el
webinars.
agradecimiento a
We
los
would like
restantes
to
ponencias
thank
del
you
día de
for
hoy,
your
las
excellent
respuestas brindadas al
presentations and
respecto de
also
las preguntas y
uh,
respuestas.
for the
Recibimos muchas
responses.
felicitaciones
We
a
have
través de nuestras
received
redes sociales. Muchas
congratulations
gracias,
on our
doctora,
social media.
doctora
Thank you
Angélica
very much,
Campos,
Dr.
doctora Gaby Lencina,
Campos and Gaby
a
Lencina.
todas y todos los
We would like to
participantes,
thank
al
all
equipo
of
de
the
Orascom
participants, the
y a
Horas
todas las personas que
CONU,
participan
and
en esta
everyone who
actividad
took part of these
virtual.
initiatives and virtual activities.
Cedo en este momento
I
la
would
palabra a la
like
doctora Malky para el cierre de este webinar,
hand the
en
floor
honor
to
del
Dr.
ponente
Malki to
brindador.
close this webinar on behalf of the Horas CONU.
Muchísimas gracias, Rubí.
Thank you
Muchísimas
very much,
gracias a
Ruby,
nuestros
and thank
extraordinarios
you very
ponentes
much to our
por
extraordinary
estas
speakers
presentaciones que
for
nos
these
gustó
interesting
esta ocasión
presentations
con el tema de la seguridad vial,
on road
que
safety,
definitivamente nos ha
which is
recordado
definitely something that reminded us
traumatismos causados por los
that
siniestros de
trauma
tránsito
caused by
constituyen
car
una de las
accidents
principales
are
causas
one
de
of the
discapacidad y
main causes of
discapacidad.
death and disability all over the world. And mainly,
Debe preocupar
I
y
think
llamar
we
a
should
atención
be
el
called
hecho
for
de
action
recordar nuevamente, porque esto es un tema que ya
by
se
once
conoce,
again remembering, because this is something known, that this is the main cause among of mortality among children and teenagers, and also young adults, which is the population which is affected, and out of four of these accidents affected cyclists and pedestrians. This is something that happens, those accidents that happen
evitables.
are avoidable if we act accordingly. The human factor is something to consider, but also it is important to mention that there should be specific standards with control and effective oversight and legitimate controls and actions geared towards raising awareness among the users of the different transportation means. We've heard about emergency support and care, how important it is to strengthen human resources, infrastructure, and the organization and governance of the system to and all the this should be understood as an investment. No, we've even mentioned a return of more than 400%, I heard. It is important, it is vital for decision makers to take a look at the situation where they can play an important role in seeing this problem as something that is manageable, that could be controlled. And we've heard about the different standards that exist around and all the tools that have been shared. So first, this is a matter of prevention, because it is always better to prevent than to regret. Prevention is more cost effective and has a longer effect, but after the fact, the health systems have to be prepared in the best ways possible with the best technology and the best resources, because we should not forget about this age group from 5 to 20 years of age, which are mostly affected, and putting this on the agenda and in the different spaces like the Horas CONU. This is some line of work that we have to work on with persistence. Having a law is not enough. We have to be there. We have to educate, raise awareness, and I think that we're all witnesses to different experiences at the subnational, national level in Peru. We've had the chance to work on a subnational space, and we saw how having an important law in the control of speed and the safety belt has decreased the number of deaths and injuries. Well, and even now, we've been doing this for more than 20 years. So far, the users know that they have to comply with the rules, because this is, I'm sorry, but the interpretation must end now. Thank you.
Debemos seguir insistiendo en la educación a los usuarios, porque esto debe ser cumplido por convencimiento, porque deben saber que es por cuidar su salud más que por evitar un pago de una multa, porque lamentablemente pues lo que más se aprecia es que, eso, lo que decía, ¿no? Es una visión recaudadora y no una visión protectora. Entonces siempre tiene que ser ese control con educación para que pueda realmente pasar y ser parte de nuestra conducta, parte de nuestra cultura, parte de nuestros actos, ¿sí? Y siempre decimos, y creo que los mejores resultados obtenemos cuando hacemos desde los niños, ¿no? En las escuelas, ya lo han mencionado también, la mejor forma de que los ciudadanos hagan suyo este tipo de conductas es tener el conocimiento desde muy temprana edad, ¿no? Y eso es colegios desde los primeros años. Nuevamente reiterarles el agradecimiento a cada uno de ustedes, doctora Melissa, doctora Gaby, por su tiempo, por su dedicación a este tema y seguiremos probablemente en adelante interactuando, intercambiando con ustedes para seguir abordando este tema y trabajar para mejorar esta situación a nivel regional y global. También agradecimiento a Ruby, que asumió la moderación, a Milagros, a Robbie, a todos los que en el Horas Con han hecho posible que esto pueda realizarse como cada semana, y a toda nuestra audiencia que también nos acompaña semana a semana, todos los jueves a esta hora. Y aprovechamos también para invitarlos para el próximo jueves 6 de junio para nuestro webinar, que es un webinar especial que es en cooperación con la Embajada Británica, que hacemos también una vez al mes. Es justamente el tema de visión británica del cáncer, logros y desafíos para su prevención. También un tema importantísimo en estos tiempos para todos. Muchísimas gracias nuevamente y hasta pronto. Gracias.
Muchas gracias.